Hey, what's going on, y'all? It's episode 18 of the Merce and Nurse
Woo!
Show. You know when you just said hello and everything, you did not look up from your screen just once.
Sorry, I was looking on things to buy and buy, sell, trade.
Yeah, I know. We're all watching you. But nope, this is episode 18. It has been almost 4, 8, 12, 16, almost going on 5 months now for doing this.
Oh my God.
I know. What's
That's crazy.
So what's new? What's new this week?
What's new? Oh, what are we going to talk about? My stories, your stories. I'm going to tell you something funny.
What's that?
I think, I can't wear my Apple Watch or anything like that. I need a Fitbit because I think I walk about 10,000 steps plus a day.
Okay. Yeah, that's good.
So we had a code. We have a code, a medical staff, gets their bag and they have to run to where it's at, right?
Yeah.
So it was like, code 2 and, Charlie Hall, whatever. So we're hauling butt, right? Going, and it's our jail, it's big. So we're going up, power walking. And there's a cell and it has a big plexiglass, and they can see us, right?
Yeah.
And so they know there's something going on because they see everybody running and stuff.
Yeah.
And, so I've been there long enough. I know the inmates and I pass meds to their hall and I start hearing like knocking, knock. And I'm just like, hauling butt, like trying to catch up. And I happen to look and one of the inmates that I know says, like he's mouthing, hurry, you're slow, run. And I'm like, so later on when I go give his meds, he comes out from one. I said, hey, and I was being funny. I said, I am trying my best. I don't need you to tell me that, but it was funny.
You ever seen those memes of like it's like you're out of shape because like you start doing you're doing a code on somebody, you're doing compressions, and then the person's hands up and just falls down.
Yes, but it was funny, and I said, "What must they think of me?" And they're laughing. I can't hear them, but I'm imagining they're like. But anyways, I laughed about it after the all the adrenaline went down. I was like, and then I started thinking, damn.
So what? So y'all go just stupid fly. Man.
I know. We knew it was gonna be bugging us. What?
Like when you go, does so you're going in case I'm guessing medical, right?
Yeah,
so
I take a medical bag. Yeah, like a lot of times it's like fights and stuff.
Oh.
That's what it was, and they broke it up before we got there. But
okay.
Yeah, and every time
I'm like, what are you gonna do? You're like, guys, stop it! Holding your bag, guys, stop.
I'm going to be like...
Let me check your blood pressure. Let me check your glucose in a second.
But yeah, I thought it was funny. So yeah, basically they were calling me fat nurse. So you know what?
No, man. It's funny you say that because I took a patient up to the floor the other day. Uh-huh. And as I'm going up there, it was just me because my nurse was working with somebody else. We had like 3 discharges.
Yeah. 2
admissions, 1 discharge. And so I'm taking mine up there, and we're slammed.
Yeah,
and we're slammed in the ED. So the sooner we can open these rooms, the better, right? And so all of a sudden, she's like, "Hey, Noah, take so and so up and I call report and everything." I said, "Yeah, cool." So I'm going up to the patient, talking. You doing okay? Yeah, I'm doing okay. We're just cruising.
Yeah,
because we have to go like the back way of the hospital where the stretchers go.
Oh yeah, with the elevator.
We get up there, yeah. And as I'm going up to the room, I'm on the 3rd floor. And I'm taking the patient in there. All of a sudden, I hear code blue, ER, room 8, code blue, ER. I'm like, I stop. I'm like,
you're like,
is that my bed? I'm like, I start thinking like, is that my bed?
You're like, that's my department.
No, I'm like, no, okay, because those were my rooms. And so I'm like, I'm looking at my patient. Patient's looking at me like they're laying in bed looking up, and I'm like. Do I need to go?
You're like,
do I need to get down there?
You're like, I'm going to park you right here. I'm going to put the brakes on and I'll come back later.
I'll be right back for you. Yeah. Well, no, so I was like, and then so I dropped, and like maybe 2-3 minutes later, you hear they canceled the code blue.
Yeah.
Which they normally never call it in the ED.
Yeah.
Because you're an ED, like that's the point. Everyone's there.
I mean, if you're going to have an emergency, you want to have it there.
Well, I mean, when you call a code,
yeah,
anywhere in a hospital, it's the ER doc,
Yeah. Okay. So you mean everybody's already there that needs to be at the code?
Exactly. And so RT everybody.
Yeah.
Because everybody lives in the ED.
Yeah.
They go out. But so yeah, I was like, why did they call the code for ED?
Yeah.
And then don't worry, just a child just got stolen right now.
Sorry.
Let me guess, was your phone on? It was on, right?
Yeah. I normally turn it off. Sorry.
Yeah, it's okay, guys. I'm sorry that you have to hear that.
I will pray for this 8-year-old.
The Amber Alert.
Female.
But anywho, so I hate you. What? Anywho, no.
Oh my God, where's his heart? I said a quick prayer for her.
I'm up there. I drop the patient off and I head back down. And when I'm like, I saw one in the text. I was like, "Hey, bro, was that real?" He goes, "Oh yeah, that's bed 8, but they're a DNR, so they cancel the code." I'm like, "Oh, dude." So I went to look at his monitor. He's an older gentleman, and I was looking at the tele monitor, bro. I mean, if you can imagine a textbook STEMI,
that's what he was.
He's in one. That perfect ST elevation. He's having a straight heart attack. I'm like, it was a textbook waveform. And so we're like, oh. And I was like, well, what do we do?
Yeah, I bet the eight's a little weird, right? Because
I'm
used to helping, doing
everything.
CPR.
Yeah, but then they're like, hey, he has a DNR. Like, we can't touch him.
Yeah, you kind of got to wait for him to just.
Because because they went in there and I passed by, but they had the pads on him, and if the crash car was there, RT, everyone was there.
Yeah.
But they were like, we can't really do nothing. So, but yeah, I was like, damn. I was like, should I leave my patient here to go help, or take the patient?
And this is just nursing humor, where you like, does anybody want to pop from the cafeteria? And this is just
no,
humor.
100%.
I don't mean that like that. I'm just saying you're like, anybody want some coffee, tea? I'm heading to the cafeteria.
But no, seriously. I mean, there's one nurse that I joke around with a lot, and she really has some nice dark humor that soothes the soul.
Yeah.
But there was a patient, and we're just looking at them. We're like, why are you here?
Yeah.
Like, why are you here? You don't want us to touch you. You get mad at us when we do like that one I did for the IV. His blood sugar was high. He stopped taking his medication. He's a young guy.
Yeah.
And then I'm like, hey, man, we got to put a line in you so we can get some fluids. We gave him some insulin, but doc wanted some fluids, to help dilute that sugar out. Yeah. All right, no big deal. Well, he doesn't have a line. So we're like, we're going to put a line in him.
Yeah.
And he's like, just to let you know, I don't, the last nurse that stuck me with a needle, I hit. And I was like,
and you're like, the last person that I hit too.
And I was like, look at him like, what? And I told my nurse, and my nurse right there, she was like, well, I hope you know that this is Texas and it's a felony to assault a nurse in the emergency department. And she goes, and we press charges here. And I'm like, I was sitting here.
And you're like, word.
And I'm sitting here, I'm sitting here like looking for looking for a vein. I'm like, just listening. I'm like, please don't hit me right now. Please don't hit me. And so I know I finally stuck him.
Yeah.
But as soon as I stuck him, he jerked his arm back. And so he
came out.
It was a great vein.
Yeah.
And it's one of those like a routine, just boop, and I'm done, I'm gonna walk away. No, I stuck it in there and boop, he pulled it out, and I'm still holding my needle and catheter. His arm's over there. I'm like, and so I just stopped, and he goes, I looked at him like, really? And he goes, hey, sorry, I don't like it. It hurts. I'm like, okay. I just walked out. I want to say, hey, can someone start relying on him? Because he won't, he's upset.
Hey, you're too young in your career to be like, I'm done. I am done. Well, you know what's so funny? Since, at the hospital at the jail we draw blood.
This fly, man, I'm sorry.
Oh my God.
We caught that on camera, bro. We caught that on camera.
Crazy.
That's so disgusting. He's flying around in my hand. I'm going to keep him. Just go. Keep going. Keep going. I don't want to lose.
You're like the Karate Kid.
Dude, you see that? Y'all it's on live video,
Karate Kid. Paint up, paint down, side to side. Side to side. Dude, that was amazing. That was crazy. But let me tell you that what y'all couldn't see. This fly is probably 100 years old because he's sluggish. He's flying real slow.
Oh, okay. Okay, we're back. Sorry.
We are back.
So,
that was so funny.
Y'all didn't see that, but I did caught a fly midair, threw him away, washed up. We're good to go. All right. Anywho, what we're talking
Oh,
about?
we're talking about the stick. And since you're
Yes.
saying that, and this is so funny. It's probably because I haven't mastered it, because that's not something that I've done every day of my life. I just started working at the jail. But every time I draw someone's blood, and I have everything together, safety needles. Once it has that little plastic that goes up. I have everything. I call myself in my head the vampire. When I take it, I don't know how.
Well, you know they call the phlebotomist vampires.
Yeah,
That's
but
like
I am so messy. Like I pull the needle out and there's blood dripping on the ground. It is so funny how much, and even the inmates are like, there's blood on the ground, there's blood on their little table.
It looks like a crime scene.
And
It
I'm
looks
like,
a crime scene.
and I have a little cotton ball cleaning it, making it worse. I'm so sorry. But I am so messy. I need to lay something down underneath. But anyways, I can imagine, how that happened.
Oh my goodness, yeah. And then we had another patient come in for. Apparently, she had we didn't know she had lupus, and then we thought she was having a flare up. And so, she pains 10 out of 10. She's in excruciating. She's screaming. Okay. Sometimes in the ER people are like, hey, what's your pain? Your back pain, right? They're like, oh, it's a 10 out of 10. And you're looking at them, you're like, no, it's not. Like
you're like getting a knife in your head. That's like a 10.
Yeah, you know what I'm trying to say?
I know what you mean.
But like her 10 out of 10, her body, and everything matched what she
was saying. Yeah,
because she was laying down screaming.
Yeah,
and like it was like one of those shrill. And so we know she's in pain, right? So, anywho, we're doing our assessments, checking her out, and notice a big old bruise on her left hip over here, like her flank, where her kidney would be. And so I'm like, that's really weird. So I asked the daughter, I'm like, hey, like, did she fall? Because the mother speaks Spanish only.
Yeah.
And so I'm asking the daughter, like, any history, like, has she fallen? Has she gotten hit?
Yeah.
And she's like, no, nothing. So like, that's weird. That bruise. Maybe, sometimes like you walk around a corner and you hit the table.
Yeah, but not
this
like
one
that.
was like big. And I'm like, huh. I was like, whatever. So I go outside. I'm typing up my assessment, my notes and everything. And I say, hey, she has a big old bruise on this side.
Yeah.
And this is where, it's very, important to actually do a full visual inspection.
Exactly.
Right. And so I was like, that big old bruise, blah, blah.
Yeah, because she didn't mention it. I mean, no one mentioned it.
No, and so we're looking at her history, and we found out she had a renal biopsy about 2 days prior. And so we're like, huh. So we got, like little detective getting clues.
Yeah.
And we're like, her hemoglobin's low. Her blood pressure's low.
Yeah, she's in pain in that area.
Like, a lot of stuff is pointing to something.
Yeah.
So we're like, hey, doc. We say, hey, this, and this. And he's like, go ahead and put an order for CT, check everything. Find out, CT come back. She has a big old hematoma. She's actually bleeding in there internally.
Oh, and it's just pulling?
It's just pulling right there, yeah.
Oh.
And so we don't have the resources, the surgeons on standby for that. So we had to transfer out to San Antonio hospital.
Yeah.
They were accepted her and everything.
Yeah.
But on top of that, Seguin was so slammed yesterday.
Yeah, it sounds like when you said all the transportation services.
It was so slammed that they weren't. And she needed ALS transport, the advanced, not just BLS, the ALS, right?
Yes.
It's 2.5 hours before they got there because they were just so backed up and there's nobody. So we had to maintain her. We gave her some fluids. We got blood ordered, but it was right in that little time frame. Like, she was still stable enough to where she's not like losing the blood like immediately. It's a small bleed that's been happening for over a time. It's not like a massive bleed. Yeah. But so it's still a bleed. Yeah. But doc's like, hold off on the blood because it was like already 30 minutes till that they were going to get there. So it was like they already got their, let them do the blood. Yeah. And because she's stable enough for us right now. Yeah. And we gave her some fent for some pain. Yeah, fentanyl. And we gave, most of you don't know, the narcotics, the opioids, it can depress your respiratory system. Yeah. People think, oh, morphine. Yeah, of course. Yeah. But fentanyl is a strong drug. Yes. That's the one that once people start taking it recreationally, they don't normally come back from the recreational. And I get them in my jaw. Well, you know what? Speaking of that, my mom had, sorry, Mom, I'm using for example, she had a scope and she was in a lot of pain afterwards. So they gave her a little bit of fentanyl
fentanyl, whatever. And she goes,
man.
"Oh my God, that stuff worked." And I said, "That's how people start off when they're non-addicts and they feel like everything's wonderful, and then I get you in 6 months." Okay, that it's the
Yeah,
feeling.
yeah.
Yeah. Anyways.
Well, yeah, no, we gave her the Fen to help with the pain. I mean, she's in,
Yeah.
excruciating pain, right?
Yeah.
And we gave it to her, and it's crazy how fast it works. And
Yeah.
and you're supposed to give it over a 2-minute period.
Yeah.
And I pushed it diluted
Yeah.
with her line about 4 minutes, nice
Yeah.
and slow, just
Yeah.
nice little taps. And then we finished the med, so we're standing there. I'm charting everything. I'm
Yeah.
looking, and I see her O2 sats going to like 95,
Beep,
93,
babe,
and 92,
babe.
89, 87. I'm like, what? And so I'm looking at her, the finger probe, and I'm like, I got a brand new one. I put
Yeah.
on a different finger.
Yeah.
I'm checking it, and it's still a perfect waveform. So I mean, it's capturing
Yeah.
perfectly, but it's 88, 85, 84. I'm like, damn, that's accurate. And so I call my nurse. I'm like, hey, we need some O2 on her now. And so
Yeah.
I grabbed some O2. I put some
Yeah.
on, and I'm like, and she's asleep. She's like,
She's having the
snoring.
best sleep
yeah,
in the
Well, I mean, she was in pain for
I know,
hours,
poor
but
thing.
yeah, but and so I'm like, oh well, she has sleep apnea, so maybe she's not breathing, so no oxygen.
And
so,
when you-
dude,
and then
we're like, ma'am, she's like, huh, and we're like, breathe, and we're just watching. And she comes back up, and I'm
Yeah.
like, so I stayed there for the next 15 minutes just with her. I'm like,
Yeah.
wake up, huh. I'm like, keep breathing.
And are you telling the family it's fine?
Well,
She's
Well, we
great.
gave, we let them know, like, hey, like this
Yeah.
is narcotic, like it can
does that.
depress, it can slow down.
Yeah.
I said, I'm here, we're watching her,
Yeah.
and so we let the doc know. He's like, yeah, he goes, she'll be fine, just watch her and just
Yeah.
make sure she wakes up. I mean, that's all it was. It wasn't
Yeah.
her like actually just
Yeah,
like
it's just
like
part
actually
of the
like not breathing. It's just she was sleep apnea, and she just wasn't breathing. She
And
just
poor
like,
thing, she was probably
exhausted,
like
man. She
exhausted
was
from the pain.
Yeah, but yeah, I was just like every couple seconds, just sort of wake up. She's like,
Are
huh.
y'all trying to block her from the family? Why don't y'all want to go get something from the kitchen? You're like, wake up, wake up, wake up.
Oh man,
I'm not gonna look bad on my shift.
No, and then she finally came through, and we sat her up her up, and because she wanted to be like more laying, because
Yeah.
it was better. It felt comfortable for her pain.
Yeah.
But I sat her up more, and she came to, and she was awake.
Yeah.
And I was like, all right, you're awake. O2 was perfect, so we took the oxygen back off,
Yeah.
and I'm like, you're good now.
Yeah.
I mean, she was right next to her watching her, and then finally we're leaving, giving a report,
Yeah.
and then they called us that the EMS was 10 minutes out, so
Oh,
they should have
good.
to head out
Good.
to go get stop that bleed.
Yeah. Well, hopefully
yeah, no.
everything turns out good for her.
And I'm like, damn. So that's what, you know what? That's why I don't like giving Fent that much.
But that goes to show you, like any kind of procedure you have, like with my
There's
mom.
always risk. Yeah.
That's why
Yeah.
when you sign the papers, just remember there's always risk. Like that doctor's probably done that 1,000 times. I mean,
Yeah, I mean-
but everyone's so different.
Oh, dude, I've almost seen. Have you seen those like TikToks or memes with the like they record their family coming out of anesthesia or whatever?
Oh, and
they're
they're
all loopy.
Yeah,
and stuff?
yeah.
We had a little girl, maybe like 11ish. Well,
Yeah.
she slipped in the morning and hit her mouth on the ground somewhere in her bathtub, and it split her from here all the way back here. Just split her gums
Oh,
open.
yeah.
And so we came in. She came in. It was like 7:30 in the morning, right? And so we're like waking up like, good morning.
Yeah.
What can I do for you? And I look at the daughter, big old gauze in her mouth. I'm like, oh Lord. I said, oh God. I said, what happened? Because on the triage, well, first off, in the morning there's no triage nurse, so they just bring them straight back.
Yeah,
Because there's no nurses in the
Yeah.
morning. And so we do triage. So all I saw was on the main one line laceration. I'm like, oh, okay. I'm thinking laceration. Like
Yeah.
she fell, cut herself.
Yeah,
something
how
simple.
kids do.
Yeah, right. We go in there, big old gauze in her mouth. I'm like,
Oh.
damn it. And so I'm like talking to mom. I said, Mom, what happened? Blah, blah, blah. And she's like, she slipped in the shower.
Yeah.
I found her and there's blood everywhere. And I'm like, okay. So I said, honey, can we pull it off so I can see? I got my little light. I looked. I saw like from here to here, just gash. And I'm like, oh, it was so nasty.
I know, bless her
and I know she
heart.
was in so much pain.
Yeah.
And so, we told Doc, and Doc's like, all right, well, he went in, checked it. He's like, all right, well, we're going to put some stitches in there.
Yeah.
And so, dude, the little girl started freaking out. And I'm like, we put her under conscious sedation, so not full anesthesia.
Yeah.
But we gave her ketamine. That ketamine is a hell of a drug.
And then they had to put shots too, right? Like in her mouth?
Well, with the ketamine, we gave her the ketamine, dude. She was just out of it. And I'm looking at her, I'm like, hello? And so when we have our RT, everybody's there, everything's there, right? We have all the monitors.
Yeah.
Because the difference between conscious sedation and general anesthesia is conscious sedation is they put you under with a medication, but they don't paralyze you and you breathe on your own.
Okay.
With general anesthesia, they put you under and then they paralyze you. So then that's why they have to breathe for you. That's why they have to intubate you.
Okay.
So general anesthesia is that's like going to surgery. Why do you need to get paralyzed? Because doc don't want you moving when he's trying to cut you. You know what I mean?
You're like, my head is just, what is that? What is I'm feeling right here? My brain.
Well, have you seen those videos like when they do like neurosurgery?
Yeah, and
they have them play or do something
like the bite. Yes,
that's insane.
Yes.
All right, but anyways, so we gave her ketamine. She passed out, and then she's there, and they put the lidocaine shots, and he started just sewing her up. 4 stitches, good to go. And so afterwards, we had to stay with her until she could fully woke up, right?
Yeah.
And so we're sitting there, and I'm right there because every 10 minutes we chart her vitals, sedation score, everything.
Yeah.
So I'm there every 10 minutes charting her, talking to mom, and all of a sudden I just see the little girl. I don't even see my eyes, but look, she goes, and she looks, but her head's still there, and she looks at me and she goes. And puts her hand down, and then she goes, and then she goes to the mom. And she did that for 15 minutes. I know it was 15 minutes because from one vital sign to the next vital sign, she went back and forth looking. And at
she's
us,
just waving at y'all.
just waving. That's it, but not even moving, just still looking and waving. And her mouth was full of gauze. And then finally, she starts coming to. She's like, "Am I dead yet?" And we're like, "Huh." What? I said, girl, you're alive. She goes, oh. She goes, well, and she goes, when are we going to start? I'm like, we're done. She goes, what do you mean?
Oh, okay, because she didn't realize it.
Because it knocked you out, and the next thing when she would come to, it's like you don't have a sense of time passed.
Yeah.
Because
it's like surgery when they tell you to count back, and then you wake up and you're like, did I have surgery?
Yep.
Isn't that crazy?
Because, when you go to sleep, you go to sleep and you wake up and you feel that time has passed in that moment.
Yeah.
Surgery, consultation, there's no feeling. It's just close and there you're done. But 15, 20, 30 minutes has passed.
Is that how it feels, you think, like when you're like in a med-induced coma? You think when you wake up,
I don't know.
You know time's passed, or you think like what happened?
Because I've heard different stuff. Have you heard like people who are like in like these long-term comas that they hear? Have you heard them?
Yeah,
that they hear
I've
stuff?
heard a couple stories.
So if they hear stuff, then I mean, I don't know if like
that's just weird, right?
Dude, that's
or maybe it's just how you wake up and you're like, I know, like you think I had an accident.
Like how did I get here?
Yeah, what time is it? What day is it? Yeah.
Yeah, it's crazy.
But so she just kept waving and waving.
Yeah, and so she starts talking to us, and I'm like, "Hey, like, how we doing?" Blah blah. Blah. She goes, and dude, she was so loopy. It looks like you gave her like 20 Jello shots. She's like, "Let me tell you something. Who is that?" And I'm like, "Who's there?" You know the TikTok jump.
Yeah,
he's like, Who's in the room with us?
When they're like, "Oh, I'm waiting for the little girls to go to sleep," and he's like, "What? What? What little girls?" How funny! So she was just So when she finally left, was she a little bit more lucid, or was she?
No. We stayed with her all the way until she came all the way out of the medication, and then
my goodness!
And then it was maybe 30 minutes later, and she was up, and we got her.
Are the stitches dissolvable?
Yes, they are dissolvable.
Oh, well, thank God for kids; they're so resilient.
No, but you know what's interesting? That the mouth is actually one of the fastest healing organs.
Oh, really?
On all your body, yeah.
Oh,
yeah, your mouth has to.
Well, you know what? I bit my lip so bad the other day, and I kept biting it. My, and it's funny because I thought it hurt, but you know what? Within a day or two, it was healed up.
No,
so that is funny you said that.
It's pretty cool.
Okay.
But man, I still have like 1,000 more stories, but I guess we'll go hit these later. What?
I'm just laughing because I mean, like I was telling last night.
Well, we've been doing this for almost
No. But I was
30 minutes,
thinking, I was at my mom's house last night, and my other son came with his girlfriend, and my husband was there. We were just there, and I just start talking about my job, and I can just talk on, and then my because it's exciting, yeah. And then my youngest goes, "Okay, already with your jazz stories," but I tell him it like my day flies by. It's always something, and anyways,
Man. So did you hear about this? That back in May, husband and wife RNs, they jumped into action and saved a man's life on a flight from Fort Lauderdale to Baltimore after a medical emergency midair.
What was he having? Like a heart attack?
He was having he just fell unconscious and his face was bluish purple. They jumped into action, they assessed him and found that he was he had a heart attack. They did compressions all for the entire time until they landed. And the EMS got in there.
And did he
live? They saved him.
You know what? That airline needs to give them some free tickets.
No kid. And it says here that the patient's family kept in touch with the wife about how they're going and how they're doing. But it doesn't say nothing about the airliners. But the family said that they're very grateful that they were there to save his life.
Yeah.
Man, I mean, you imagine like you don't talk about they're at the airport. They're like, "Oh, we have a medical emergency right now. Is there any doctors on board?" And you're sitting there like,
"Are you like, I'm gonna watch this in-flight movie, Avatar," and you're like that. And all of a sudden, you hear, like you're someone tapping you. Aren't you a nurse? And you're like,
I'm off duty. Leave me alone.
I'm on vacation. I'm off clock. That is awesome. That goes to show you that he wasn't meant to die.
But you know what? That's. It sounds funny, but you know how like people make fun of people who like practice all the time or prepare for or carry like a medical bag in their vehicle, but
for times like that,
you just it takes that one time that you need it or that because I carry a tourniquet in my truck and I carry a little first aid kit,
especially when you're on the highway and there's a wreck and
and I'm like a simple tourniquet because I don't know if I told you this, but I took a stop to bleed class. Mm-hmm. If you're bleeding from artery, you can bleed out in less than 2 minutes. Less than 2 minutes.
Yeah, and especially if you're on a highway and you're waiting for.
And it takes the average response time for EMS is about 6 to 9 minutes.
Yeah.
So you'll be dead before it even get there.
Yeah.
But all just a simple tourniquet. I mean, it's just
things like
something.
that. Things like that. Yeah, just being prepared.
Oh man,
that is too funny.
But yeah, so if you're on an airline and you're a nurse, a doctor, a vet. Like a veterinarian, I don't know. You can say a cat, but
hey, and this is kind of funny because you know how they're always telling you we're preparing to land. They come on, we are preparing to land. So please, everyone in your seats and seatbelt. That goes to show you really don't need a seatbelt because they were on the ground pumping this. That goes to show you, you'll be okay if it was a good flight. You don't need, you don't need to be in your seat.
Can you imagine if it wasn't?
Yes, because
some air turbulence,
you see videos where the carts fly up and drinks and everyone's drenched. Everyone knows Jesus by the end of the flight. I just had a personal relationship right now. Oh, that is crazy. Oh yeah, that is crazy.
But before we leave it off, I want to leave you with a quote like we always do every week.
And this is a very good one. I like it.
All right. Make sure your worst enemy doesn't live between your own two ears by Laird Hamilton.
That's a good one.
I mean, you think about it. You are your own self.
You're your own worst enemy.
Yeah,
that's what they would say.
Self-critic. And
yes,
if anything, you are the hardest on yourself.
Yeah.
But I mean, it just says it. Don't let the worst enemy be yourself.
That is true. And I think about when I read this, I was thinking about when I first started, I was terrified to draw blood because over 20 years, I didn't have to do that. We had the hospital coming in. They did all the hard sticks. They just did them. So when I started, I would tell Noah, give me a crash course, I mean, because it's a skill that you got to use, to utilize.
Yeah. You have to actually do it.
Yeah. And so Noah would, he was showing me, we would do things and sometimes I think I'm just too funny. I think everything's funny, but anyways, and when we were SLAM, you get, all these labs. And I just said, well, I told my friends today, well, y'all watch football? They're like, yeah. Because they're asking me how it was. I said, you know what a Hail Mary pass is? And they're like, yeah. Many times I do a Hail Mary blood draw pass. I'm just like, Jesus. And like, I was being funny, one of the inmates, this girl, and I did the sign of the cross. And she's like, why are you doing that? I said, it's my first time. I hope I stick it right. But anyways, but it's true. You just being confident, quit letting yourself talk. Most of the time we talk ourselves down from things and then we don't complete them. So yeah. I like that. That reminded me of myself.
Well, that's all we got for today. Let's say catch us on the YouTube, like and share, pass it around with everybody.
Y'all have a great day.
Y'all have a great one. See ya.
Bye-bye.